A new study adds to the growing list of concerns about the potential dangers of antibiotics. It suggests giving your baby the drugs too soon could set them up for being overweight children. Our TV6 reporter Stacia Matthews has the details for us. Stacia.
Erica, for more than 50 years, farmers have known giving their livestock small amounts of antibiotics makes them plumper. Well, this new study could shed some light on what happens to humans.
You better smile at them. Yes.
7-month-old Avery is enjoying the day in the park with her grandmother. But a month ago,
She had a high fever, and so we took her to ER, and they said that they thought she had a bladder infection. So they pumped her full of antibiotics and gave a prescription for antibiotics.
she got more antibiotics when she was admitted to the hospital 2 days later.
When it was all over, she had no need for any of the antibiotics because what she had was viral.
A new study says babies exposed to antibiotics before they're 6 months old are likely to be chubby toddlers, even though their weight tends to return to average by the time they're 7. Researchers found that unnecessary use of the drugs can disrupt healthy bacteria in the gut, leading the body to make and store more fat.
We are in the midst of an obesity epidemic.
Dr. Anthony Giaquinta is a pediatrician with Hendricks Regional Health. He says if antibiotics are contributing to childhood obesity, this is one factor doctors can control.
If we can identify risk factors and hopefully prevent obesity before it occurs, then we could have some dramatic effects down the line.
This is the first study to analyze the relationship between body mass and antibiotics. But it's not saying babies who need the drugs should not get them.
Yeah, providing antibiotics is something that pediatricians need to do with discretion, but it is a very important element to fighting disease.
Now, researchers say more studies are needed to confirm their findings. And Erica, we're certainly going to be hearing a lot more about this.
And we've been hearing a lot about antibiotics being used so much they lose their effect.
That's absolutely true. You know, the doctors say that is especially true when the antibiotics are used inappropriately. So when they're used too much, they don't work when the child truly needs them.
All right, good to know. Thank you, Stacia.